Now, there are many reasons why the Princess Margaret Cancer Center has achieved its world-class standing. The size and scope of our research and patient care programs, the role we play in educating and training cancer leaders from around the world, our breadth of international partnerships, all of these factors have helped us become one of the top 5 cancer research centers in the world. But we could not do any of this without the vital funds raised by our community of supporters. Simply put, it is you who are the difference makers. And this unique position in the global network of cancer research allows us to recruit exceptional scientists from all around the world to conduct their work at the Princess Margaret. One of these stars is Dr. Mathieu Lupien. Dr. Lupien is a senior scientist at the Princess Margaret Cancer Center and an associate professor at the University of Toronto. He earned his PhD at McGill University in 2005, after which he pursued postdoctoral training in Harvard in medical oncology at the Dana-Farber Cancer Institute at Harvard Medical School as an Era of Hope Fellow. Dr. Lupien is a world-renowned cancer scientist. His research program focuses on breaking the code of cancer by finding epigenetic determinants of cancer. The goal is then to match these determinants to tailored therapies and deliver precision medicine. Among other honors, Dr. Lupien is a recipient of the Canadian Cancer Society Bernard and Francine Dorval Award for Excellence, the Rising Star in Prostate Cancer Research Award from Movember, and he is a 2-time recipient of the Till and McCullough Discovery of the Year Award. Please join me in welcoming Dr. Lupien to this virtual breakfast event. Welcome, Mathieu.
Thank you very much. Thank you very much for the invitation, and thank you for everyone to attend this morning to this session. It's a real pleasure to be here. And what I have for you is a set of certain slides to present that will showcase the work that we've accomplished, and as well highlight how we fit within an ecosystem of research that is built around both academic centers as well as private sector. So I presume that you now see a nice picture of myself. While we're all right now working from home, for the most part, there's still actions taking place within the lab. And there's evidence that I've been in the lab in the past and that I'm still going to the lab with this picture that's shown up here. So as pointed out, I'm a senior scientist at the Princess Margaret Cancer Center. I've been here since 2012. And so what I'd like to do today is specifically cover a few topics. First, show you or educate you on a perspective of what the cancer research ecosystem is all about, and then delve into the details of the future of cancer care, specifically providing a perspective that relates to the work we've been doing in breast cancer. Now, why do we need cancer research? I think that the numbers speak for themselves. We know that about 1 in 2 men and 1 in 3 women will be diagnosed with cancer in their lifetime. And so what that implies is that for each and every single one of us, cancer is personal. It's either that we will be or have been diagnosed with cancer, or that a loved one will be diagnosed with cancer. And so what we want to make sure of is that whenever a diagnosis comes in, it's no longer perceived as a death sentence, but rather perceived as an indication of a chronic disease that we can manage. And so with that in mind, what we need is research. And when we talk about research, we often talk about a lot of things. There's actually 4 different types of research that can take place. And these are here portrayed along a tree, which more or less reflects the nature of each of the different types of research as they fit into nourishing a tree to make a tree ideal and make a tree very flourishing. And so the first type of research that is at the bottom, at the root of all of research, is called basic research. That's the type of research that's focusing on discovering the fundamentals of life, the fundamentals of diseases as well. This is often where work leading to Nobel Prizes originates from. The second type of research is known as translational research, which is here portrayed as the trunk and the branches of the tree. Translational research is when we assess the value of basic discoveries for clinical impact. And so this is typically where we'll be working in the lab, such as the ones at the Princess Margaret, working on model organisms, working, for instance, in tumors that are growing on a petri dish. The third type of cancer research that is of relevance is referred to as clinical research. And this is when we're testing in patients the value of translational discoveries. You've heard about clinical research abundantly in the last few months with regards to COVID. as there's been phase 1, phase 2, and phase 3 type of trials testing new vaccines, for instance. That falls within the realm of clinical research, and that's been empowered and made possible because prior years had been invested in basic research and translational research, for instance, to better understand the onset of disease and be able to translate this discovery into a clinical setting. The fourth type of research is known as population research, and this is when we study the cause, the pattern, and the effects of health and disease. So for instance, through populations research in the past, we had discovered that smoking was related to an increased risk of developing lung cancer. Similarly, we had discovered that sun exposure was related to an increased risk of developing skin cancer. And so these are the four different types of research that are central to a research endeavor. And of course, funding basic research and translational research is fundamental to ensuring the growth of that research tree, because again, that's coming from the root going up to the trunk before it reaches the clinical research space, which is more or less the fruits and the leaves that come out of that tree. What are the players that establish this ecosystem of research? Well, of course, there's places like the Princess Margaret Cancer Centers, these research institutes, these cancer centers, which we're fortunate to be amongst the top 5 in the world, right, as leaders in research and care. We also have these biotechs and private companies, biotechs and pharma, that are leaders in drug discoveries. And this ecosystem works together because they have fundamental differences in their operational system and in their organization system as well. So for instance, cancer centers like the Princess Margaret's are heavily focused towards making discoveries in an open access format, so as to make sure that the world is aware of every single detail that went into making that discovery, such that we can be assessed for robustness and reproducibility of our discovery. And at the same time, because we're not a for-profit organization, we can invest massively in basic and translational research to fuel clinical and population research. And that's really an aspect that makes us unique in this ecosystem landscape. But at the same time, we benefit for the strong commitment towards drug development and the likes from the pharma and the biotech companies, which can then fuel heavily, significantly clinical trials as well. This ecosystem has worked very effectively over the last decades. This figure specifically showcases the improvement in the overall survival, 5-year survival in cancer patients. Now, there's a number of different types of cancers that are portrayed in this figure, but I'll draw your attention to the first arrow, which is looking at the advancement in survival, 5-year survival for all cancer types. In the 70s, it used to be around 50%, which corresponds to that pink dot. Now in the mid 2010s or so, it's roughly around 67%. And so there's been a significant improvement in the cancer survival rates over the last decades. And this has been made possible because of research, because of the strong investment of research. We've improved our ability to early detect, we've improved our approaches for prevention, and we've improved our therapeutic methodologies as well. We're fortunate here at the Princess Margaret to lie within an amazing ecosystem. There's a reason we're amongst the top 5 cancer centers in the world. And this draws in good part from the tight relationship and collaborations that there is between the clinical teams and the research team. The fact that our hospital is just a 5-minute walk from a research tower makes it such that it's extraordinarily convenient for clinicians and scientists to meet on a regular basis and exchange ideas. This ensures that researchers are fully aware of the needs that are important for patients as they're brought up by the clinicians, and vice versa. Clinicians are fully aware of what's coming from the discovery side in terms of changing care procedures, changing new treatment, okay? And so Princess Margaret is a phenomenal environment to work into, where it allows for that transition, an accelerated transition of all basic and translational discoveries into a clinical setting. Now, my perspective about the future of care as it relates to breast cancer definitely is fundamentally rooted in the concept of precision cancer medicine. This concept of precision cancer medicine applies to a number of different aspects. It applies to disease monitoring, it applies to prevention, but in my specific line of work, it applies to treatment. And what I think about when I consider precision cancer medicine as it relates to treatment is this notion of wanting to move away from this one-size-fits-all type of strategy. So this is a strategy that has been in place in the past, where patients that would develop a certain form of cancer, for instance, let's take breast cancer as an example, would come in and they would be provided one therapy. And in this case, one blue pill. What happens under such a situation is that the treatment only works in a small subset of individuals. So the blue individuals would respond to the blue pill and you would see a positive effect in terms of survival, for instance. But a number of individuals would have no benefit from that treatment or even potentially have a disease that would worsen. And so we want to move away from that one-size-fits-all model. We want to move into precision medicine, which is this concept of being able to look at patients and analyze their tumor in great depth, allowing us to assign them to different groups that are truly similar to each other and paired with a given drug that works for them. And so, for instance, in this given example, individuals that would come in with a blue type tumor would be given a blue pill and the effect would be positive. Individuals that have an orange type tumor would be given an orange pill, and then the treatment would allow for a positive effect, improve survival, and so on and so forth. In this desired effect of providing for precision treatment medicine, the key is solving that black box of precision medicine. And what we need there is code breakers, individuals like myself and my team that are specifically committed to breaking the code of cancer. And so here's my team, a group of young individuals, highly motivated and highly committed to decoding cancer. And in our specific way of doing things, we do it using epigenetics, which is one of multiple ways by which we can decode cancer. We use epigenetics because we believe it's the most powerful method to discriminate identity in patients' tumor and the ideal approach to maximize matching a treatment to a given tumor's identity. And so to that regard, I'll give you an example of what we did, specifically with our focus on breast cancer, a disease that affects 1 in 8 women worldwide, a disease that is known to have multiple different subtypes. And the specific subtype that we paid attention to in the current study that I'll be discussing is the triple negative breast cancer subtypes. This subtype accounts for approximately 15% of all breast cancer patients. This is one of the most aggressive forms of breast cancer, and it's also one that's typically diagnosed earlier in life compared to the other types of breast cancer. And so it's often diagnosed in young mothers, for instance. This disease is a problem when standard therapy fails. So the red line here is the event-free survival data looking at individuals that had an inability, individuals in which standard therapy failed. And what happens is that within a 5-year period, over 50% of these individuals will develop some form of event. And by event here, we mean a recurrence, for instance. If you go past the 6-year mark, it's 100% of individuals that will develop an event, such as a metastasis. And so we call this a recurrent tumor. And so what we wanted to do is specifically find ways to treat a recurrent tumor. And the approach we used was based on epigenetics, which underlies the concept of trying to find weaknesses within the genetic architecture of breast cancer. And so this is the one slide on science, okay, that will be presented to try to summarize the work we do. So a normal cell here, the white cell, would normally go down this landscape of differentiation to become a breast cell. So this would be a normal stem cell, like a precursor, and in the course of development would go one way to become a breast cell, would go into a different way to become, let's say, a brain cell, a muscle cell, or anything of that flavor. And then from this point, it can keep maintaining its identity and maintain a breast-like state, or in some unfortunate circumstances, and can take a different path and end up in being a breast cancer cell, okay? And so what we want to do is prevent this path from being engaged. This path is established by the genetic architecture that underlies this landscape. So this is looking under the landscape. We have all these scaffolds that are merging the DNA, the genetic information, with the phenotype, with the identity of the cell. And these scaffolds is where the epigenetic information is used to define exactly which scaffolds are going to be where, establishing this given landscape. And so the task of my team is what? Is to play around with that scaffold. First, figure out what the scaffold is in a cancer setting, and then see how we can move the scaffold around to do one of two things, either from a cancer state push it up into a normal state or push it down the cliff. We're fine with pushing it down the cliff, right? The key is to eliminate this valley from the landscape such that we don't have to deal with cancer anymore. And in so doing, we've been fortunate enough to make a discovery in the recent years that showcased that we could use epigenetic therapy, so a therapy that would move around those scaffolds to effectively offer a treatment opportunity for patients that would fail standard therapy. So triple negative breast cancer patients that would fail chemotherapy would have an opportunity to see their tumor stop growing or shrink using epigenetic therapy. Now, this discovery was done in a preclinical setting and needs to be validated in a clinical setting. But what I'd like to do now is just show you a 1-minute video that explains exactly what our discovery was that was published in the last year. And so this should start now. Excellent. All right. So with this, I would say a huge thank you to all the efforts you've put forward in trying to assist the Princess Margaret. And I hope that the information that I provided was useful. And I look forward to having the chance to interact with you in the future in person, hopefully soon. Thank you.